welcome to this 8th session of WAS Conversations. I'm Alain Rudolph. I'm the president of the next WAS conference that will be hosted in South Africa from 9 to 12 September, and it will be in Cape Town at the Lagoon Beach Hotel. I can promise you it is the most iconic view of Cape Town with Table Mountain towering over the Atlantic Ocean. If travel is permitted, I would love to see all of you there. It will be a hybrid conference, so you are also welcome to join us online. I'm co-hosting this series with M.Sc, who is the honorary president of the Congress from Nigeria. We are proudly introducing this conversation, which is presented in association with the Kinsey Institute at the Indiana University. Our topic for today is research on sexuality and sexual health during the COVID pandemic. Please say hello to us in the chat and let us know where you are from. We have a full registration here on Zoom today, and we are also streaming live to Facebook. So this series has been planned by the core team that's planning the conference. And since this is the last one of the conversations, I just want to personally thank our core team. It has really been hard work, and we had to figure out a way of staying connected with the WAS members and also introducing WAS to many new members. And we welcome all of you, and it is such a privilege to have been able to get into your homes and into your offices and share what WAS has to offer with you in partnership with all of the partners that you have seen over this series. So the core team was the WAS executive and the scientific committee, and most of them are on our team today, and I'll introduce you to them shortly. But people that aren't here will be Esther Corona. She has to represent WAS at a very important other meeting at the moment. She's the vice president of WAS and has really been working hard on this series of conversations. And then, of course, also Anthony Smith, who is the president of SASHA, the local host organization, and then Marlene Wasserman, who is the local scientific chair. Now, I would like to introduce you to our team for today, and I would like all of them to switch on their cameras for you to be able to see them. So firstly, we've got Pedro Nobre, who is the president of WAS, and he is in Portugal at the moment. Hello, Pedro. And then Luis Perelman, who is the Secretary General Treasurer of WAS, and he is in Mexico. We've got Eric Janssen, who is the Vice Chair of the WAS Scientific Committee, and he is in Belgium. Thank you, Eric. Eric did all of the hard work to put this session together. And really, Eric, it's been an absolute pleasure working with you. It's so nice to have such a control freak on the team. And then we've got Alain Giami, who is actually the chair of the WAS Scientific Committee, who will be a speaker today. He's in France. We've got Linda Campbell, who is in Belgium at the moment, and Jaime Barrientos, who's in Spain. And then Gunta Lazdáne, who is in Latvia, and Justin Garcia from the Kinsey Institute, who is in the USA, of course. Welcome to all of you, and thank you from my side for your contributions today. We are really looking forward to it. So I would like to introduce the moderator of today to you. Before I go over to that, I would just like to remind you to please put your questions into the Q&A section. Don't put them into the chat. In the chat, we'll be sharing lots of interesting information with you, and you are welcome to share your comments there. But if you have questions for the panel, there will be a panel discussion at the end of the session. We'll be going for 90 minutes. Then please put it in the Q&A so that they can easily select it from there. So over to introducing our moderator for today. Eric Janssen is professor at the Institute for Family and Sexuality Studies at the University of Leuven, Belgium, and senior research fellow at the published extensively on the topics of sexual psychophysiology, sexual aggression, hypersexuality, risky sexual behavior, sexual dysfunction, and more recently, sexuality and relationships. Eric developed, together with John Bancroft, the dual control model of sexual response, and has received a number of scientific awards, including twice the Hugo Beagle Award with his students, the Star Award, the Rice Theory Award, and the AISR Best Student Manuscript Award. Eric is the past president of the International Academy of Sex Research and vice chair of the Scientific Committee of the World Association for Sexual Health. Eric, as I've mentioned to you yesterday, I refer to your model literally on a daily basis. It applies so well within our context in South Africa, and it's really a privilege for me to introduce you as the moderator of this session. Over to you.
Thank you, Elna, for that wonderful introduction, and welcome to all of you attending this webinar. It's the 8th webinar in the series of WAS Conversations, and the last one of this year, and a year probably that most people would love to see come to an end. Undoubtedly, 2020 will for always be known as the year of the coronavirus and its associated coronavirus disease, or COVID-19. The pandemic is leaving its marks, with lasting scars, and has impacted our lives in many different ways through the loss of loved ones, economic and financial challenges, and the severe constraints that have been placed on and that have impacted our social connections. The COVID-19 pandemic is not only an epidemiological crisis, but also a social and psychological one. All over the world, researchers are examining its effects on mental health and well-being, on families, and social and intimate relationships. And this includes sexuality in its broadest sense. And we thought it was appropriate for the World Association for Sexual Health, or WAS, to have a webinar on research during COVID-19. The mission of WAS is to promote sexual health and sexual rights throughout the lifespan and across the world. And in its approach to this, it relies heavily on scientific inquiry and evidence. Research on the impact of the pandemic includes a focus on access to sexual and reproductive health care, effects on sexual violence, sexual behavior, and sexual function, just to name a few. Today, we want to give you a flavor of what kind of research is being done in the realm of sexuality and sexual health. And we have a wonderful lineup of speakers. I will introduce them to you as we go. We're starting with Alain Giami, who will present us with a wider historical and sociological perspective. And this will be followed by examples of research from the iShare project, an amazing project involving over 30 countries. Today with examples from findings from Latvia. And we also will get some presentations on research from Chile and the USA. Okay, let me start with introducing next speaker. Alain Giami is Emeritus Research Professor at the INSERM, the National Institute of Health and Medical Research in Paris. I wanted to say Paris, it just sounds better. He is the chair of the scientific committee of the World Association for Sexual Health, and he also is the associate editor of the journal Sexology, a European Journal of Sexology and Sexual Health. He serves as member of the advisory committee of the new Centre Maurice Chalumeau on Sciences de Sexualité. I hope I said that relatively okay, Alain. At the Université de Genève. He has published books in French, English, and Portuguese, including most recently Histories of Sexology Between Science and Politics, published by Palgrave in 2021, to be published, and co-edited with Sharman Levinson. Alain is currently coordinating an international network on health and citizenship among trans persons, involving France, Brazil, Chile, Italy, Norway, Denmark, and Portugal. Alain, over to you.
Thank you, Eric. Thank you for inviting me to this conference. I need to find my paper, which has disappeared again. Excuse me, 1 second. Oh, voila. Okay. Here it is. Okay, thank you for inviting me to this, and I guess I have 15 minutes. So I represent here myself and the WAS Scientific Committee at the same time, and I want to remind the point of view of the WAS Scientific Committee, which is engagement in science oriented to sexual rights and sexual justice. And I would try to identifying questions and controversies rather than presenting synthetic results of research, and putting the research in the sexual rights, sexual justice perspective. As a reminder, I want to remind that WAS issued a statement in May 15, 2020, speaking about the difficulties and the impacts of the COVID-19 crisis, and putting focus on sexual health, sexual rights, access to sexual and reproductive services, and protection of gender and relationship minorities and other vulnerable persons and groups. So this is, the perspective of action of WAS, and of course, the development of good research is part of this project. What I want to say first, that if we are assisting a very important development of research since about 1 year ago, I need to remind that there is a historical memory of the link between sex research and disease and political condition situation. Let's not remind even that the complex political influence on the Kinsey report, which started in the 30s and before, and which was supported by various United States organizations, including the Rockefeller Foundation, until its discontinuation, because it did not match anymore with political situations. Let's remind that the 70s, the paradigm of research on sexual behavior was broadly influenced by contraceptive and youth sexual relation, including what was called at that time premarital sexual relation. In the 80s, 90s, the sex research moved and increased, exploded dramatically with the onset of the HIV/AIDS epidemics and with the development of hundreds of surveys to understand the behavior, to understand the relationship, the representation, and with a new focus on homosexual same-gender behavior, which almost did not exist in the previous step. In 1994, with the Massachusetts study on old men, there was a new paradigm of studying the old people and sexual dysfunction due to the onset of Viagra in 1998. Then we saw a big development of chronic disease and sexual function, including cancer, diabetes, HIV, Alzheimer, autism, and COVID-19. So medicalization is an important incentive for developing sex research and survey in particular. And we can see here a table of the research of the relation between some chronic condition, cancer, diabetes, Alzheimer, and autism. And we see that the development of research since the years 40 has not followed the same progression. The most important body of research was developed for cancer and sexuality, with about 15,000 research paper published in Medline, and we see that diabetes received less attention. No speaking about the mental chronic condition such as Alzheimer and autism. So, and we see that there was a very strong development, and that the development of the last almost 10 years is even more important than in the last 50 years, 80 years. So we can see that there is an important incentive for the development of sex research, and in particular for the link between a chronic condition and sex research. We can see that when we do the same search for COVID-19 and sexual, we see that Medline reports already 381 papers, and the Web of Science 194 papers. The Journal of, more in our field, the Journal of Sexual Medicine has already published 33 papers with those keywords. The Archives of Sexual Behavior, 11 papers, and there is a call for paper. And the Journal of Sexual Research did not publish yet any paper. So we can see that according to the lenses we use to analyze those the development of research, the data do not appear as being the same, and the focus of every research is not the same, so it's dependent from the social and political context. We can see that the call for paper of the Archive of Sexual Behavior launched last year proposed some topics, important topics, which can be summarized as a focus on those at risk, principally, sexual and gender identity minorities, access to healthcare organization, and sexual rights. But we can see that there is a strong focus on the political context and on the situation of those who are not part of the majority, who are supposed to be the most at risk for COVID. There is also a call for paper of the Sexology, European Journal of Sexology and Sexual Health, that was launched on June, and the sexual issue will be published as the first number of 2021. So rather than presenting results, synthetic results of research, I will do a very narrative and subjective discussion of the question and controversies that remain open with the important bodies of research that we have, with the help of Eric, that we have reviewed and discussed, but I am the only responsibility for what I am saying. First, we can see that there is a diversity of sampling approach and sample size. The NatSal, for example, COVID in the UK has more comprehensive sampling strategies and collected interviews, questionnaire among 6,654 people. The Kinsey study, which is represented here, did an internet snowball study with 1,559. And we can see, and there is also a French study led by Brice Gouvernet, who did also an internet social network study and collected 1,079 questionnaire. But we can see that in most of these studies, and these are representative, there is a majority of women responding to this study. The other problem, I mean, the controversy, is the question of the patient sampling, which produce a small sampling or large sampling, and which will make difficult, and the difference in sampling also and collecting data, which will make difficult to make meta-analysis of the survey, even if some people have tried already to produce this kind of analysis. The indicators, there are some gender differences. We have more women. We have in some cases, we have a focus on married heterosexual mainstream people, and on the other one, we have also a focus on sexual orientation and gender identity people versus the general population, or those people are also included in the national study, like in the NatSal study, who overrepresented the same gender and transgender people. There is a big focus on vulnerability. There is a new kind of framework of the relationship status, like married, steady relationship, cohabiting, or single, which appear as independent variables to understand the functioning of sexual activity and sexual satisfaction. And there is also an indicator which is less frequently taken into account in many studies, which is a question of housing and what is a household, which is the size of the house, the size of the number of people living in the house, and what are the characteristics of those people? Are their parents? Are their children? Are their family? Are there other people? So this dimension have been observed as creating some important differences in the experience of sexuality and sexual activity in this context. We have also some concepts that appear, and I have chosen what the three important studies that I have reviewed. The NatSal first introduced a new concept, which is the romantic sexual, which in my view did not appear in many studies before, but which appear at the flagship, of the conception of sexuality. And we can see that there is a double approach of the meaning and the purpose to study sexual activity. On one side, sexual health is an important dimension of health and well-being, including romantic and sexual needs. But on the other side, romantic and sexual needs appear as risk factors and obstacle for compliance to isolation and social distancing measure, in particular among people who are not cohabiting or who are not in a steady relationship or who are single or who are people who need to go out to meet their partner. The other idea which appear in the NatSal UK study is a possible comparison with the national representative NatSal studies, which will facilitate the analysis of change by comparison of the sample of the NatSal COVID and the other NatSal, and the fact that they use the same instrument for research. And we shall see that the idea of measuring change is also a complex issue. For the Kinsey Institute, the major innovation is about the concept of adaptation and creativity and relation to well-being, and the impact of sexual changes on satisfaction, which is different according to the relation status and the gender identity and sexual orientation. Gouvernay in France developed more widely the question of emotion, cognition, affecting sexual satisfaction and dissatisfaction. So one of the most important points to focus on is the fact that most studies are about the impact of social measure, impact with health, medical, psychosocial, and sexual health implication, and not fewer studies the impact, the pathological impact on sexual reproductive function, semen, ovulation, birth, but most, which is the physiopathological impact of the virus itself on health. So most of the studies are the studies of the consequences of the lockdown. Another aspect which needs also to be developed, the question of inequalities, which are revealed and increased by the situation of the pandemic, to understand that those who are more affected by the social aspect of the pandemics are already those who are more vulnerable, which are minorities, youth, women, refugees and migrants, commercial sex workers, who appear also an important number of people, and the fact that social class and social structure would need to be developed a little more. There is a kind of consensus about a relative decrease of partnered actual sexual activity among those who are not on steady cohabiting relationship, but also sometimes on those who are sharing cohabitation. There is a diminution of sexual satisfaction and a relative increase of techno-sex, including access to internet porn and the development of masturbation, and these are related to difference in social partner and sexual orientation status. We need to try to understand better the possibility to make comparison across studies and with studies with larger sampling, like national studies, and to understand the difference between the feeling of change and the actual change which occurred in the situation. I'm sorry I've been a little bit longer, but thank you for your attention.
Thank you, Alain, for that very interesting, excellent presentation. You know, if you do a regular PubMed search, you will find more than 75,000 publications on COVID-19 already in this short time. And I just quickly checked, like clinicaltrials.gov, there are like more than 4,000 clinical studies registered just in the US for clinical trials. It is an amazing and fastly expanding literature research database. Okay, we're going to hear more about a fascinating project called the iShare project. And we will have two speakers, Linda Campbell and Gunta Lazdáne. And I'll introduce both of them to you now, and then Linda will start, followed by Gunta. Linda is a global health, public health researcher and program manager, beginning her career in designing and delivering sexual health programs for marginalized young people in London, in the UK. Subsequently working in HIV and GB virus programs and research in Namibia, India, and South Africa, as well as in the economic evaluation of hepatitis C virus programs for HepCare Europe. Linda is currently undertaking a Ph.D. On the social determinants of household support for anti-retroviral therapy adherence in South Africa. Gunta Lazdáne is a professor in reproductive health and the director of the Institute of Public Health at the Riga Stradens University in Latvia. Between 2003 and 2017, Gunta was program manager of the Sexual and Reproductive Health Program in the Regional Office for Europe of the World Health Organization. This is a long sentence right there. She has served on scientific committees for a number of congresses and conferences, and she was the editor-in-chief of the European magazine for sexual and reproductive health, Entre Nous. Well, among us, between us, Linda and Gunta, over to you. Look forward to your presentation.
Thanks very much for the introduction. That's very much appreciated. Right, let's see if I can get this presentation started. Here, it's a real pleasure. All right, I'm going to be talking about the iShare study that's happening at the moment in over 30 countries. So iShare stands for the International Sexual and Reproductive Health Survey in the time of COVID. So why is this an important aspect to study? Okay, because COVID-19 poses numerous threats to human health and well-being. It's not just the virus, it's also the COVID-19 regulations themselves that have a profound impact on our lives. The social distancing regulations and the access to healthcare, the impact on healthcare have a profound impact for our social and economic status. So as you can see here, there's some clips from numerous news outlets from the beginning of the pandemic. I'm sure many of you will recognize some of the stories that we're here today. So there were concerns at the beginning of the pandemic about the impact that stay-at-home orders and lockdowns would have in terms of interpartner violence. So we have a picture here. They can, these lockdowns mean that women are trapped with abusive partners, for example. Pregnant women were worried about the pandemic's impact on giving birth. We've had several stories from the UK recently where pregnant women have been separated from their babies, even though they're being breastfed for long periods at a time, and birthing partners have not been allowed in the delivery room with them. There are risks of children being taken out of school for too long and the risk of them not returning subsequently. So all these aspects, as a result of the COVID-19 regulations, are incredibly important to look at. So here is a table drawn from a modeling study. The study is Riley et al. In 2020. The estimates of the potential impact of COVID-19 pandemic on sexual and reproductive health in low and middle income countries. The data is taken from the Adding It Up study. And so they estimated, okay, so what would be the potential impact as a result of disruption in the provision of sexual and reproductive health care? As you can see at the top, there's what's the estimated impact of a 10% decline in the use of short and long-acting reversible contraceptives. Their estimate was about 48.5 million additional women with an unmet need for modern contraceptives and a potential 15.5 million additional unintended pregnancies. What would be the potential impact of a 10% decline in service coverage of essential pregnancy-related and newborn care? Well, they estimated a potential 1.745 million additional women experiencing major obstetric complications without care, which could result in 28,000 additional maternal deaths and 2,500 additional newborns experiencing major complications without care. And potentially an extra 168,000 additional newborn deaths. They estimated the impact of a 10% shift in abortions from safe to unsafe, and they estimated that this could result in an extra 3.3 million additional unsafe abortions and a potential 1,000 additional maternal deaths. This is all fairly significant, of course. And here we can see a graph of the percentage change in cancer screenings during COVID-19 in the US. So data pooled from 60 healthcare organizations. And as you could see, no surprise here, March, April, a big drop in the percentage of cancer screenings happening. And depending on the restart strategy, the reduction in screening would lead to between 0.13 and 2.35 additional breast cancer deaths per 100,000 women between 2020 and 2030 compared to undisrupted screening. So why this study? Well, sexual and reproductive health, as we all know, that's why we're all here today, it's an essential part of health and well-being and represents a major disease burden globally. So 32% of the burden is amongst women of reproductive age. And there are strong indications of an important impact of the COVID.
We may need to switch just in case. Linda had some computer problems earlier. My apologies, our apologies for that. Hopefully Linda will return. We'll continue with your presentation, Gunta. Is that okay?
Sure, no problem at all.
Thank you.
And sorry that Linda's presentation didn't finish, but I am sure she will manage. So iShare is a part of the big international study that was mentioned by Eric in more than 30 countries. And Latvia is just one small part, and but we were one of the first countries to start and one of the first countries to finish the survey. So that's why maybe I will start now with my Latvia data, and then Linda will give more background of what's all that is for the globe. So iShare in Latvia was and is, because we still have not finished that, in Latvia is part of a big research council study, impact of COVID-19 on the healthcare system and public health in Latvia, preparing the health sector for future epidemics. That's the funding of this project in Latvia. But iShare in many countries are just voluntary. So when choosing the priorities for our 2 million country, we chose those ones we are sure are the possible highest risks, and that is the mentioned those already problems that may be modeling of the results that have been presented all over the world, HIV and sexually transmitted infections, and of course, sexual health. So from the international joint survey, and that was very interesting to hear the first presentation that diversity of methodologies in different countries, we really followed the common structure, the common survey questionnaire, except we did not focus on female genital mutilation in Latvia. And we tried our best to organize and to have online survey responders from July 26 to September 6, when it was the first wave. Actually, the first wave in Latvia of COVID-19 was much less impact than the second wave now. It ended in 1,173 responders. That for our country is really great results, because in principle, during these times, everything goes on online. And so every day, each person who has some kind of device receives at least few invitations to join the survey. So I will just give a glimpse of some of the results from Latvia that were directly linked to what was discussed. So the outcome, no surprise, 88% of responders are women, and only the rest, as you see, are men and other. So women in Latvia are more interesting in sex. Joking. So from the age groups, 18 to 32 years of age is more than 70% of all responders. We're a little bit sorry about this, this other end, because we invited everybody over 18. So that means this taboo, or at least attitude towards sexuality after 50, 55 years seems still in place. That was the way how we said thank you to all 1,173. So it's just an example of Latin language. So here we go. Few results. Influence on COVID-19 social restrictions on sexual activity with steady partner. As you see, it's almost with no major change. More than 50% stayed the same. Even around 20% increased a bit, maybe because more time to be together. But at the same time, also around 20%, 1/5, was really decreased a lot or decreased a bit. If we look on satisfaction with sex life, then this picture is different. Before COVID, it was quite good in average. Even better for women than men. But during COVID, it changed dramatically for women. So for women, and average was with statistical difference with a decrease of satisfaction with sex life. That's also, there are explanations for that, especially of the being all the time at home with children and all the tasks and duties and working from home. For a woman, it may be stressful, more maybe than for a man. And change in the amount of tension in one's relation with the partner since the introduction of COVID-19 social distancing measures. So again, much less is around 25%, but more is almost 30%. So tension is increasing. Tension in our relationships, tension in society is increasing. And with this tension increasing in one's relationship to the partner, it decreases satisfaction with sex life and decreases sexual activity. That is statistically significant. Violence against women. There have been a lot of publications since COVID-19 pandemic started related to increase of violence. And we see just that emotional violence before and after COVID measures have changed against women in Latvia. No physical and sexual. And here I need to mention that we went further and we started qualitative research. And here the picture is totally different. So difficult to say the reasons why online survey didn't really give this possibility for people to show up and to speak up. And there are a few more results. No change in access to condoms. So good news, we're happy about that, but almost 25% of respondents had no access to HIV and STI testing. 15% of people living with HIV delayed or postponed HIV treatment. So this is really damaging information for Latvia that has the highest new HIV cases in European Union. So I'm not proud to be on the first place this time, but here we are. And we have discussed these results already with the Ministry of Health, and we hope that we will have a possibility to influence the outcomes, and we will have the possibility to show a full picture of results in an iShare session, maybe in South Africa next year. Thank you very much.
Okay, thank you very much, everybody. Thank you so much, Gunta, for that. And I'm terribly sorry that my video cut out. So I'll go back to where I was. And I will hopefully be able to share the screen again now. So going back to where we were, as Gunta has very kindly indicated, we had a need for real data to inform policymakers on how to take sexual and reproductive health into account for future health crises. And she very kindly indicated that we have been able to do that. Okay, so how did we do this? Well, basically, Christine Michelsen sent out an email earlier this year, and there were some responses to it. The result was a collaboration between Ghent University, the London School of Hygiene and Tropical Medicine, and the University of North Carolina to create the iShare study, the International Sexual Health and Reproductive Health Survey in the time of COVID. We have over 30 countries involved in the first round, Latvia being one of them. Some of them are highlighted on this very helpful map in blue. And as you can see, it's been quite a global endeavor. So what have we been measuring? Well, Gunta has already given you a flavor. We've been looking at access to reproductive health commodities and services, for example, contraception, antenatal services, and abortion, HIV and STI treatment and testing, harmful cultural practices, such as FGM, sexual behavior, mental health, and we've had input from all of the countries into what we should be looking at, how we should be looking at it, which scales to use, and so on. Each country has translated the survey into their local languages and has field tested it, importantly. It's been a really iterative process. So how are we measuring it? We're using an online survey for all of the positives and negatives that that implies. It is convenient sampling, so there will be an amount of selection bias because it will, of course, mean that people have to have access to the internet and be computer literate in some way to enable them to do this. In order to spread it as widely as possible, we've been spreading it through social media, using organizations' mailing lists and using direct messaging. So what's been happening so far? Obviously, 9 countries have finished and closed the survey, Latvia being one of them, and you've just heard from them. And other countries' data collection is still ongoing. So for example, Australia and Canada. We hope to finalize all data collection for iShare by the end of 2020. And then we will be able to disseminate the results via articles, conferences, and policy briefs. So what's the future for iShare? Well, we're doing a second round. So UNFPA, Eastern Europe and Central Asia has joined us for the second round, which means 11 additional countries from the region. And several countries from iShare 1 have shown interest in a second round as well. iShare 2 will therefore be in approximately 20 countries and will be launched late 2020 and early 2021. The survey has many similarities to the first survey, but some additional new things because obviously the situation has evolved. Thank you very much for listening, and we appreciate your attention. If you have any questions about the survey, please do contact Christine. Here are her details, and I'm sure we'll be sharing them further. Thanks very much.
Thank you so much, Linda, giving us 2 mini presentations that actually really worked well together. and almost came across like a whole. And thank you, Gunta. Fascinating work, a really wonderful project. And also the finding from Latvia, the fact that we see quite a bit of individual differences in the effects, which has been reported by others as well. And also it seems like one thing that is emerging from some of this research is that there are really disconnections at times between the effects on behavior and the effects on more psychological constructs, you know, satisfaction and pleasure. Really, really interesting. We have to move on. I would like to introduce Jaime Barrientos Delgado, Associate Professor of Psychology at the School of Psychology, Universidad Alberto Hurtado in Chile. And he's a pioneer in LGBT research in Chile. And his research focuses on homophobic violence, the impact of prejudice and discrimination on the mental health of gay men and lesbians. In addition, he has conducted research in MSM and male to female transsexual individuals and has adapted and validated different measures about homophobic violence in Chile. Jaime belongs to the editorial boards of numerous Latin American research journals in psychology and sexuality. And he's co-author of a number of peer-reviewed research articles in LGBT issues. Jaime, over to you.
And thanks for the invitation to be here, to you and to Alain. Today is a pleasure for me to be here online and
Amy,
to
sorry,
present...
your sound is...
Wait. Okay, now?
Yes, it's good.
Maybe.
Thank you, Amy.
It's a pleasure to be here this afternoon. Today I want to show some of our results. This research about the impact of COVID on LGBT population in Chile is part of another project, a cross-cultural project conducted by
Jaime, are you there? It looks like we're having some technical issues. There you are. Jaime, we missed the last 20 seconds or so. Could you go back a little? You were hanging for a little bit.
Okay, don't worry. Thanks.
You can go ahead, Jaime.
Okay. Probably, you know, the COVID pandemic has led many countries around the world, including Chile, to take different measures to prevent this pandemic. Lockdown, stay-at-home measures, closure of public services, and teleworking recommendations. But which are the effects of this type of measures? You know, quarantines derived from the measures taken to prevent COVID have an impact on our mental health, but also on our quality of life and well-being. For example, physical and social distance have affected our social relationship and our perception of empathy toward other people. And usually, we are likely to be in a situation of social disadvantage given the prevailing stigma against us because of our sexual orientation and or our gender identity. And following the minority stress theory created by Alain Meyer, this stigma produces stress, which produce negative health outcomes. But what do we know about the effect of this type of measures in general population and in LGBT peoples? Recently, research in general population showed that this type of measure produce anxiety, depressive symptoms, sleep disorders, and post-traumatic stress. And in LGBT communities, this type of measure produce a higher risk of domestic violence, social isolation, and increased anxiety. Why? because the social distancing measures might lead to confinement a lot of LGBT people in unsupportive homes, increasing their exposure to discrimination, stigma from their family. And especially LGBT youth experience also less access to essential social support and social connection and mental health services during the pandemic. No research in LGBT population has been reported from Latin America today. But we found this one about the effect to quarantine in Chile in general population. And here you can see the most important result, were concern and anxiety. And in the younger population, the most important consequences of the quarantine was concern about employment, finances, mental health, stigma, and general health. Then our objective was to describe some psychosocial effects of COVID on the mental health of the Chilean LGBT population. Here you can see my country in the Latin American area. Probably you know that my country is most well known around the world for its amazing and beautiful landscape. In the north, here you can see the Atacama Desert, and in the south, the Torres del Paine, and not for its social research, but we produce a lot of social research too. Here you can see some selected indicators from my country in different areas. And here you can see our position in the LGBT Global Acceptance Index. You can see that Chile is well placed, but we still need to improve a lot if we compare our position with the Iceland or Netherlands position. The method, this study is part of another one conducted in different countries. Jorge Gatto was the coordinator of this project, and here our first paper accepted in the Journal of Homosexuality. The method, we use an online survey taking between 15 to 20 minutes. We have 1,181 participants, all of them over 18 years old and self-identified as belonging to the LGBT population. Here you can see the most important socio-demographic characteristic of our sample, and please see here our sexual orientation classification. We have 3 categories: homo, bisexual, and asterisk sexual, including pansexual, demisexual, queer, and asexual people. And please see this question too, the percentage of people living with their parents. We use 3 types of measures: socio-demographic, psychosocial consequence of COVID measures. We create 7 items, and finally we use the DAS-21 scale to measure anxiety, depression, and stress. Here in the following table, you can see the percentage of participants answering a response category equivalent to 10 in our psychosocial effect of COVID, according to our classification of the sexual orientation. Please see these 2 responses. Here we have a significant difference between our sexual orientation groups. And we found that the most emotionally affected by the pandemic was the asterisk sexual group. And also this group was the most suffocated in the LGBT identity. In this following table, and this is an important table because here we have the percentage of participants over cutoff point in symptomatology in depression, anxiety, and stress. And here again, you can see the most affected group are the asterisk sexual group. The asterisk sexual group have more depression, anxiety, and stress. In conclusion, our result shows some different psychosocial effects during the COVID pandemic, depending on the type of sexual orientation reported. Also, our results give evidence of disparities within the different LGBT group used here. If you remember, we used 3 categories: homosexual, bisexual, and asterisk sexual group. And the most affected group was the asterisk sexual group. Also, this study visibilized subjects self-identifying in categories different than the classical one, homo or bisexual, then the people name it as pansexual, demisexual, asexual, queer, or gender non-conforming is a growing category in my country. We need to focus too on preventive interventions and the implication of increased risk in sexual participants who are the most affected by COVID in Chile. Also, if you remember, last year, my country led different social mobilizations against the economic and political system. These social mobilizations are named Chilean social outbreak. Then many Chilean LGBT people had to face with this Chilean social outbreak and those taken for COVID, which could have resulted in more negative effect for the LGBT population. Finally, the anti-gender movement and the anti-gender policies arrived to my country, and they are generating and producing an increase in incitement to hatred towards LGBT people. Then we must follow this action to our population. Thanks, everybody.
Thank you. That is a really interesting work, and it is wonderful to see studies that focus on LGBTQ and other groups. And it is wonderful to see, also in this webinar, different countries represented. And we're going to end with studies conducted by the Kinsey Institute, and I am very happy, thrilled to introduce Justin Garcia. I had the pleasure of working with this wonderful man for several years when I was still at the Kinsey Institute before moving to Belgium. Justin is the executive director of the Kinsey Institute and Ruth Hall's associate professor of gender studies and the IU bicentennial professor at Indiana University in Bloomington, Indiana. His research focuses on the evolutionary foundations of variation in courtship, intimacy, and sexual behavior. He has co-authored dozens of academic articles and book chapters, and he is co-author of Evolution and Human Sexual Behavior, published by Harvard University Press, and co-editor of Evolution's Empress, Darwinian Perspectives on the Nature of Women, published by Oxford University Press. He's an award-winning researcher and educator, and has lent his expertise to a variety of industry partners, serving as a scientific consultant to the KY brand, Teva Pharmaceuticals, and others. And as an expert witness for the US Department of Defense, he has served in that role as well. Since 2010, he has been scientific advisor to the world's largest relationship company, Match. And Justin's next book is titled The Intimate Animal. Justin, over to you.
Thanks so much, Eric, and thanks everyone else. A pleasure to be with you all today and be a part of this panel. Actually, Eric, I started my career with Eric right next door, so it's always fun to do these sorts of events with him, even if we can't yell down the hall of the Institute at each other anymore. Okay, let me share. Okay, do those look good? Are those showing up correctly, my slides?
Yes.
Perfect. So today I want to share a little bit about our study, one of the studies we've been doing at the Kinsey Institute looking at sexual behavior, particularly with a focus in the US. So I'm actually going to hop through 3 different analyses. So I'm going to talk a little bit quick just to give a snapshot of some of what we've been working on. So in the context of thinking about COVID in the United States, one thing for us to think about is what the rates have been like for COVID-19 infections. As many of you know, the United States is not even close to having the pandemic under control. Here's a snapshot from some BBC data on the number of new daily cases and the number of daily deaths. So one question for us, particularly early on, as we were seeing this rise, the sort of rise of numbers and serious concerns about the ability to contain infection, was what might be going on with people's romantic and sexual lives. And to be totally honest, the way the study started was we were sort of interested in it, but it was the headlines that were getting our attention. So very early on in 2020 in the United States, there were all sorts of headlines. This is from the Wall Street Journal, one of the major newspapers in the US, and in terms of readership, and really thinking about what might be happening. Is there an impact on sex? And what was interesting for us was in terms of the sort of popular conversations happening, there were a few predictions that circulated. One was that there'd be a baby boom, that there would be lots of sexual behavior happening in people's homes, and that there'd also be an increase in divorce. And it turns out that what the data overall show is that those predictions were all not true in terms of what people just assumed what was going to happen. There may have been, there's a little bit of evidence that very early on, there may have been an increase in sexual frequency, like that first weekend of quarantine, but that didn't appear to stay. So I'm going to talk through a couple of our data findings. So I'll start with our study called Sex and Relationships in the time of COVID-19. So we started collecting data in March 2020, early on in the pandemic, at least in the US context. The sample is actually a multinational sample because, as Alain said earlier, it was a snowball sample. So we collected through Kinsey Institute social media and continued to collect. So although it's multinational, it does heavily favor the United States. And then I'll talk a little bit more about a study that's specifically US focused. The study itself is longitudinal. So we had a large T1 sample of over 4,000 people, and then follow them for 2 weeks in T2, T3, T4, and then move to monthly for T5 and T6. We had a pretty sharp attrition rate after about T3, T4. It was shockingly high in the first one. People stayed in the study and then they got fed up. And it's one of 5 studies that are currently ongoing at the Kinsey Institute on the impact of COVID. Other studies on marriage with the condom use research team involving folks like Bill Yarber, Stephanie Sanders, and Cynthia Graham, and others, and a few other studies as well. But this one is the focus on the sex and relationship one. So our first article that came out early on was for a special issue of the journal Leisure Sciences. And what we found was, this was in a snapshot. So one of the interesting things about this data set is as we were continuing to collect T1 data, we took snapshots. So the manuscripts that are resulting from it have different ends, different sample sizes, because we're pulling at different times. So in one of the first studies we reported on was a sample of 1,559 people, adults in the sample. And there was sort of 3 big takeaways from this article, and I'll show some of the exact behaviors in a moment. Overall, we saw a decline in sexual frequency. So 40% of our participants reported a decline in sexual frequency, regardless of their gender identity. And as one, I think, illustrative example, we asked people before the pandemic about sexual behaviors, and only 2.4% said that they did not masturbate in the year before the pandemic. But that number jumped up to 20.2% who said that they have not masturbated since the pandemic. And the masturbation number is interesting because it tells us a little bit about what might be going on with sexual desire and sexual frequency. And not necessarily just access to partners, because one of the things that we were wondering about was with the rise of quarantine, perhaps part of if there's a decline in sexual frequency, is it because of an inability to access partners? People don't want to go on dates, they don't want to use apps, they don't want to travel around to see partners. But in fact, even in terms of solo behaviors, we saw a pretty precipitous decline. We also asked people to rate their overall sex life. So it was sort of a measure of sexual quality and sexual satisfaction. I'm a little bit hesitant to say that, particularly to this audience. I think that it wasn't a sort of standardized measure of sexual satisfaction. We were trying to get a sense of how people were rating their overall sex life. So we saw a decline, overall a decline in the quality of sex life. So 43.5% of participants said that they had a decline. Interestingly, there are some folks early on who said that they had an improvement in their sex life. So I want to just highlight that there is quite a bit of variation there. So, but overall, while 43% said no change, another 44% said that there was a decline in the quality of their sex life. And then the last thing that we reported on in this study, in this first paper, was that about 1 in 5 of our participants reported a new addition to their sex life. So although there was this overall story of decline in frequency and quality, about 1 in 5 people were adding something new to their sexual life. And this is the study my colleagues Justin Lemiller, Amanda Gesselman, and Kristen Mark, all at the Kinsey Institute. And Kristen's also at the University of Minnesota. Here's one of the tables looking at the frequency of new additions to participants' sex lives. And I just want to focus on maybe the top 3 or 4. What's really interesting is that when we asked a really wide battery of sexual repertoires. And when we dive into the actual items that people were adding, so a number of people were saying that they used this as an opportunity to try a new sexual position, either with themselves or with their partners. Really interestingly is that number of people who said that they shared a sexual fantasy with a partner. And I think that also highlights some of the other data now coming out on the impact of COVID on relationships. Work by my colleagues at the Institute, but also work by Rhonda Balzerini and Rich Sletcher, showing that overall that there does appear to be some positive improvements, particularly for married couples since COVID. So in terms of their relationship dynamics. And I think that some of this corroborates that it's for some individuals in relationships, it's an opportunity to turn to your partner and have a conversation about sexual fantasies that they've never had. And that's what we're seeing in the data, that there are, for some people, these opportunities to connect in new ways and just have conversations or try new behaviors that they haven't. And we're familiar with the data on things like sexual variety and novelty and communication, sexual communication, and the positive impact that that has on relationships, both in the short term and the long term. Interestingly, also, people acted on those sexual fantasies, played with a vibrator or a sex toy with a partner, gave a partner a massage, took a shower or bath with a partner. So even just looking at these top numbers of things that people were adding to their in-person partnered activities, a lot of them are interpersonal in nature. So then we also asked people about solo and distance-based activities. So additions of sexual, so we broke down the sort of sexual repertoire into those things that involved a partner and those things that didn't necessarily involve a partner in the same physical space. Interestingly, a lot of these had to do with the use of technology. So what we did see throughout is that a lot of people were using mobile technologies and integrating them more into their sexual life and their romantic life during this time. Also, interestingly, a lot of the online dating app platforms have introduced chat features, video chat features into their platforms since the pandemic. So in some ways, it was a moment of technological innovation for a lot of companies to think about how to help people connect in new and different ways. Particularly when it comes to courtship and dating and sexual behavior. So we see, for instance, here in the distance-based activities, a lot of the major additions to repertoire was sexting someone, sending nudes to someone, watching pornography either by themselves or with a partner, having cyber sex with someone, and even searching for sexual health information online, filming themselves masturbating. So a lot of these had to do with use of mobile technologies and connecting. In separate work we've done, it's looking at sexting thing. I think the real issue just becomes about the security of the data, right? Not necessarily that the sexting itself is problematic in terms of when we look at this, but that the non-consensual distribution of images can be problematic, and that we don't have information on. Okay, I'm gonna hop through 2 other things quick. We were also interested in, particularly for, if we dive in a little bit deeper, what about for relationship status and how might that have an effect on sexuality and relationships? I'm personally interested in singlehood as one type of relationship status, and things like courtship. Actually, the question that I've been really interested in is things like kissing, and are people more concerned about kissing and mouth-to-mouth contact? My colleague Amanda Gesselman at Kinsey told me I have to stop talking about kissing, but I can't. I think it's really interesting in terms of thinking about, it's such a high exposure activity, but for many people, it's part of our notion of a courtship process. So for me, though, kissing is part of a larger repertoire about touch. So I want to just share some of our work on touch. So we know when we think of intimate touch, in a multinational study by Julia Hyman and colleagues, those who engage in more frequent kissing and cuddling report greater sexual satisfaction. Intimate behaviors like foreplay and touch appear to directly impact sexual satisfaction, work by Amy Muse and colleagues. And in one large US study conducted by my colleague Dave Frederick and I and others, couples who were more sexually satisfied reported higher levels of emotional closeness and hugging, cuddling after sex. Now, in general, this is a non-COVID study on a project Amanda Gesselman and I did with 1,000 married people in the United States, 1,001. We found that about a third said that they're not touched enough. This was before the pandemic. So then we get to this moment where there's social or physical distancing guidelines, and particularly for singles, right? Not necessarily the ability to come close to partners. So when we think about relationship dynamics, I think a precursor to sexual activity is this larger umbrella of just touch, a physical connection, which is sort of baked into mammalian social behavior and engagement. So that's when we started to think, well, maybe what's going on is that lack of physical touch might be impacting traits like psychological loneliness, which in turn are having these effects on the negative effects that we're reporting on sexual frequency and quality. So we know that loneliness has a number of impacts on people's romantic and sexual lives. One of the most shocking findings, I think, from Juliana Lundstad is that in a meta-analysis of 148 studies and over 300,000 participants, loneliness carries a similar risk to the lifespan as does smoking 15 cigarettes in a day. And we know it's associated with all sorts of negative psychological and physical outcomes. But it also, relationship status, so to this question of singlehood as maybe a factor, it tends to have direct but also somewhat indirect effects on loneliness. It's not just having a partner doesn't mean that you're not lonely anymore. And that might be influencing whether people are seeking out sexual partners and potentially putting themselves at risk to find physical connection and sexual partners. So in another snapshot of our sex and relationships in the time of COVID study, this time with a sample of 2,000 people, 2007 from the T1, we asked some of those questions. We used a 3-item UCLA loneliness scale, which measures, it's been well validated, looking at psychological loneliness. And we conducted a series of regression models. And I want to just give the punchline because I want to fit in one more thing before I wrap up. And we looked at general loneliness measures. And what we found that loneliness was significantly impacted by age, satisfaction with intimate touch, relationship satisfaction, and stress. But we then asked about current COVID-related loneliness. And we found those same things, except that COVID-related loneliness was also impacted by sexual satisfaction. So that there seemed to be something about loneliness during this particular COVID moment, unlike in general, that was being influenced by sexual interaction, that we were some ways measuring it. My one colleague said, well, maybe there might be something even going on if we feel a little bit of sort of anxiously attached at this moment, many people, that could be pulling that out. We know, for instance, that people who are anxiously attached tend to use sexuality as a sort of thermometer check on relationship dynamics. So perhaps something like that is going on, although I think it's a little bit too unclear at the moment. So the findings suggest that stress, satisfaction, and intimate touch impact loneliness, which also might be impacting some of these romantic and sexual outcomes, particularly across relationship status. And I want to end on just a couple of quick snapshot findings from our Singles in America study. So this is a large study that we do of single adults in the United States. We just wrapped up our 10th year, so we collect data every year in partnership with Match.com, a relationship company, the online dating company. So we don't look at people who are on Match. We collect a national demographic sample using a third-party data collection firm. We've been using Dynata for the last few years. And we collect over 5,000 people and looking at their romantic attitudes and behaviors. So just a couple of this with my colleague, Amanda Gesselman and Helen Fisher. So this isn't a sample of 5,000 singles in the United States. So what we found was that, and it's demographically balanced. So 71% of singles in the Singles in America study said that they didn't have sex with anyone during the pandemic. I think this again goes to this notion that relationship status impacts sort of opportunities for sexual activity. Singles in general, we know have lower sexual frequency, but particularly time. And this is one of my favorite numbers. I had to throw it in. 1 in 4 participants in our Singles in America study had sex with a non-romantic roommate since the start of the pandemic. So that's about a quarter of people who are turning to their roommates as potential sexual partners during this time. And just 2 more quick things I want to show. 2/3 of singles said that they are ready to date in real life again, particularly Gen Z, so younger generations. 36% of singles say they'll be more selective about who they date. So this notion that people are getting more engaged on their dating market. And I think the big thing, the big take-home message I'll end on is I think video dating, particularly in the US, has really added a new step in the courtship process. And I think it's one that's here to stay. So we see that high numbers of people using video chat and video dating to connect with romantic partners and also sexual partners. So rise of things of using video to have sexual interactions. And 69% of our singles in our sample said that they would do it again. And I'll wrap up now because I think we get to have a fun discussion with everyone. Thanks so much.
Thank you, Justin. Fascinating data. And I personally really love, the fact that you focus on things like loneliness, and because one thing that we, could talk about a bit in our general discussion as well is, not just the prevalence of certain types of problems or changes in behavior, etc., but the mechanisms and, the reasons why things may go in one or another direction. I would love to hear all your thoughts about that, by the way, but I can imagine that loneliness, for example, is an example of a potential final common pathway, sort of, that all kinds of things can play into that, including, financial, economic challenges, and that it's close to sort of the more proximate cause, but other things may play into why those things are experienced more by some people than by others. I don't know, do you want to respond to that maybe already? And others can jump in, and we will check and monitor the question and answer window. So anyone who has questions and wants to make comments, please do go ahead.
Yeah.
Alain?
Yeah, thank you for all these fascinating papers, because yes, of course, I apologize if I didn't get the last research of everyone, but it was done very quickly. But I am happy to see, I would like to make a couple of comments. I'm happy to see that for the first time since many years, we are moving away from the risk model, the risk paradigm, even if a lot of papers speak about risk, increased risk with being at home, being confined, with not being able to go out. This is a very important dimension. But for the first time, we have some papers that criticize the fact that sexual activity is decreasing on one side, and which was never the case in the current, to my knowledge, in the current, in the last years. And then the study, and especially I'm thinking of Justin, the creativity that is of new sex, which means that it seems to me that beyond the observation, we are facing a major anthropological change in the way we organize our sexual lives, and things will never be the same if we go out from this pandemics, if we ever go out from this pandemics, because we are changing our lifestyle in a very deep way, and this is something I think very important to observe, the fact that the absence of sexuality and the decrease in frequency of sexuality is becoming a risk factor for mental health, well-being, and whatever.
I love that, and I others jump in, please. But Alain, I love that, and I think that really is this sort of creativity and innovation. As some of you know, by training, I'm an evolutionary biologist, so I often think about, how does our species pull off this kind of stuff in terms of these sort of anthropological moments, and I think it is a testament to actually this sort of human animal, the ability to be creative and innovative. And I mean, interestingly, one of my colleagues in informatics has been telling me that the technological innovation in the last year has been it's been like a decade in the span of a year. And in terms of how we connect, and that's impacting our romantic and sexual lives. I mean, even the fact that dating platforms now have, they had the power to do it, but they did it in 2 months to change how we're connecting. And that's more sensory information as opposed to just texting. You hear someone's voice, you see their body language, you see the artwork behind them, you see all things that we know from the 20 years of mate choice literature that's involved in romantic and sexual attraction. So I agree. I think it's an important point.
Anyone else want to comment on this, or maybe share some thoughts about work that you have presented or that you heard others present. I see one question here also from Nadia Morant. Are there running studies about the impact of people living with disabilities on sexuality? I don't know if any of the speakers are aware of that. But feel free to jump in, speakers, if you would like to share any thoughts or address any of the things that have been talked about. Linda.
Hi, yes, just in response to the question about studies on disability and sexual health, with the upcoming iShare 2, there we have been told about a study that UNFPA is carrying out in Eastern Europe and Central Asian countries, specifically with women with disabilities, around sexual and reproductive health and access to sexual and reproductive health services. So that should be quite interesting to see the results of sometime next year.
Eric, may I?
Can you unmute, Gunta?
I haven't unmuted myself.
Yeah.
So I just would like to go on with just what's said regarding people with disabilities. WHO Collaborating Center in Cologne, Germany, is doing a lot of work on sexuality education for this specific target group. And I think they are starting a small study, but I should dig more regarding the COVID-19 influence on that. But it's a very great idea. The problem is also, of course, how to manage that in these times with a lot of lockdowns and many other things that are influencing that. And the complement also was, I would like to say, this move away from the risk model. I just, I'm becoming an old woman and I'm saying like, a few years ago when I was in World Health Organization, it was such a huge debate. When we were developing the European Action Plan on Sexual and Reproductive Health, regarding this positive sexual health, positive approach and risks, and positive one. So I was very happy that we managed to develop this action plan, including this positive attitude rather than scary, no, risky, but positive, pleasure, enjoyable. So, but yes, it's not easy during COVID times.
Yes, if I may respond to Gunta, but I feel that there is a kind of paradox that it is in a moment where there is a decrease in sexual frequency and sexual satisfaction that it comes up in research as almost a central topics. In times of how do you say that big disponibilities, when we had everything, we didn't think about that. Now that the resource for sex are scarce, we think about that in research. And I'm speaking, of the models that I used in research mostly. And the policies will come later, I think.
Other thoughts and questions? I see here a very practical one. Bella Matos asked, what were the ages of the 1/4 who had sex with their flatmates? I'm assuming the younger age groups.
Yeah, it's a great question. So we have the Singles in America study is ages 18 to 90. So it's a pretty wide distribution, but it tended to be, you're absolutely right, it tended to be influenced more by younger age groups. So the 1 in 4 was overall, which was interesting. It was across all age groups, but most heavily by, we break it down by generation in that sample. So Gen Z and millennials and sort of people sort of under the age of 35 tended to shift to the average.
Thank you. Additional thoughts, questions? So one thing that I'm wondering about is, Alain made clear there are already quite a few publications out there, and of course there's a lot of ongoing research that we will still hear about, I'm sure, in the future. And of course what we don't have a whole lot of data about yet is really changes over time, and comparisons pre-corona COVID-19. I mean, so a lot of the work that is being done with questionnaires and interviews is of course based on self-attributions of impact of COVID-19, right? And I wonder what your thoughts are on that. Bit more from a methodological point of view, I guess. Anyone? I was very quiet suddenly. There are studies, I'm sure there are longitudinal studies, that started years ago and that will have data during COVID as well, which will be really interesting complement to everything that's being done.
I did have one thought, and actually one of the comments by Ankur Angrawal made me think in terms of what's going on in India, they're reporting. Early on, we had a lot of questions about, is there going to be a baby boom? And also the work that Linda and Gunta are doing in terms of impact, how we apply this to policy. There is a separate literature. My collaborator, Justin LaMiller, reminded us that there's a separate literature about the impact of things like natural disasters on things like in demography, on reproductive outcomes. And that's, I think, somewhat informative to this moment, because you can look at sort of short-term versus long-term stressors. And if there's short-term stressors, like a tropical storm, there tends to be a baby boom 9 or 10 months later. But long-term stressors, not so much, because you start to worry about the economy. And I think that's, for a lot of people, what they're worrying about now, about long-term health, the economy. If the environment feels threatening, that's not conducive psychophysiologically, Eric, we're in your territory, of what we know is involved in the sort of groundwork for sexual desire or thinking about reproduction. And so it could be that we view the environment as threatening right now, even if not all the things together. We do in the US at least.
Oh, I'm sure in lots of places. It is close to time, Elna, correct?
Yes, thank you,
On my
Eric.
behalf, I'd like to thank everyone, and I give the floor to Elna.
Thank you, Eric, and thank you to each one of the panelists. It was really excellent. Yes, we do the Zoom hand clap for all of our panelists. Thank you for honoring us with your time. And I would like to tell you about our series next year. It will be hosted by SASHO, that is the Southern African Sexual Health Association, who is the host for the WAS Congress in South Africa next year. And it will be presented in association with WAS. Our first session will be on the 17th of February, and it will be on sexual justice. So we would really like to invite you to continue to support these sessions, and thank you to everybody who has joined these sessions, even if it was your first time today. We hope to see you again at our following sessions. And then, of course, we would like to invite you to the conference in South Africa next year from 9 to 12 September. As I mentioned, you see I'm wearing my most African outfit in order to motivate you to come to our conference. We will just share a short video with you to invite you to South Africa now.
South Africa, a country on the tip of Africa, where the Atlantic and the Indian Ocean meet. Here you'll meet the biggest smiles of your biggest fans, all 57 million of us. You'll come face to face with the unexpected and be unexpectedly surprised. You'll meet great minds and you'll meet new ideas. Shared over interesting plates mixed with glasses of different opinions, you'll meet your dancing feet and your inner child. You'll meet inspiration at every single turn. You'll meet an energy unlike in any other place, in the very place where our humanity began. Come meet the biggest experiences of your life, and you'll meet a piece of yourself that will be forever changed. South Africa. Meet here, grow anywhere.
Thank Thank you, Michelle. And I really want to thank Michelle, who has been our technical support for this whole series. You've been absolutely excellent. And we really appreciate everything that you have done for us. I see that our President, Pedro Nobre's camera is on, so I will hand over to him for the very last word. Thanks again to everybody for joining us and to our panelists. Bye.
Thank you very much, Elna. Just to say that this was a fantastic adventure. This is the last session of the series. It's been amazing speakers. Everyone was quite involved. Thank you, Elna, for all of your hard work, the South African team and everyone at WAS. And we welcome everyone that is watching, have been watching this series of WAS sessions to please continuing with us and join the WAS Congress next year and join WAS. Thank you very much and bye-bye.